Universal health coverage is a concept that seeks to ensure that all citizens have access to quality health care, and that the healthcare is affordable, is accessible, and it's of a quality that will be beneficial to all of the people who are accessing it.
Everybody within Bauchi State, when he's going to hospital or any of the healthcare delivery point, should not think of money as an obstacle to access.
Wannan tsari da ya fito na taimakon mutane da mata masu ciki da ƙananan yara da kuma gajiyayyu da kuma masu bukata na musamman irin mu kama abin da ya hada da makafi, kutare, kurame, to gaskiya muna matukar farin ciki akan wannan abu da ya so kanmu har muka shiga.
Tallafi ne suke taimaka mana a masu ƙananan ƙarfi.
Gaskiya 100% al'umma sun karbi wannan tsarin kuma suna jin daɗin wannan tsarin.
So there are numerous ways of achieving, or at least aiming to achieve universal health coverage. This includes having a social protection program, for instance, that takes care of the poorest of the poor. Having health insurance that covers the formal sector and the informal sector of the society. So if that was achieved, that will take us a long way on that journey towards the universal health coverage. In Bauchi, already the Basic Healthcare Provision Fund has gone a long way in trying to enroll people onto the health insurance scheme to protect the vulnerable population.
Well, the functions of the agency are, number one, to mobilize resources, specifically as financial resources for enrollees. When we get these funds, we pool it, that is pooling. And then after the pooling, we do what is called strategic health purchasing. We buy packages of primary and secondary services at accredited primary healthcare centers, as well as general and cottage hospitals, as well as tertiary hospitals across Bauchi State. And then apart from that, after we have bought the health care services, we are expecting the enrollees to be accessing the services at these healthcare facilities. If it is primary, at primary healthcare provider, if they need referral to a secondary, they will be referred, and the secondary healthcare provider, which are mostly general hospitals and cottage, they will provide the services and then we reimburse them. Well, the agency was following the signing of the law in 2017. I was appointed in 2018 with the mandate of establishing the legal framework, the institutional framework, as well as the operational framework. The legal framework, we don't have much challenge. The law has been signed. We have a committee that is looking at the way we are implementing it and advising. So occasionally or periodically we'll be taking some of these observations to the Bauchi State House Committee on Health for the amendment of the law for better implementation of the program. Right now we have more than 45,000 enrollees. More than 43,000 are from the federal government Basic Healthcare Provision Fund, and we have about 2,000 from the state government 71 million life performance for results.
Initially, we started enrolling the beneficiary last year around January. That was 2021. and the program started actively in July 2021. So we enroll 137 beneficiaries from each ward. In Bauchi LGA we have 20 wards, so each ward we enroll 137. That is to say we are having 2,740 beneficiaries, enrollees that are under this scheme. And these, they are under 4 groups. We have women of childbearing age, that is women that are capable of giving birth, the age of giving birth. So they can come for maternal health services. We also have children under 5 because they need support. Then we have vulnerable group like the disabled.
When the program was introduced, we are asked to educate people about it and ask them to come for registration. Then we go around throughout the ward, community by community, to inform them about the program so that they should come and register. And after a lot of people have answered our calls and come for the registration.
There are 2 ways of making the payment. There is what we call capitation. This is what we pay in advance. And then there is what we call fee for service. Normally after the services were rendered, then we reimburse the facility. So we normally pay for example, let's say in this month of April we want to pay for May. In the last week of April, that is when we make all the necessary arrangement for the payment. Before this month ends, we pay all the capitation for the services of May, while the other service, which is called the secondary service, is in a form of reimbursement. The referred cases from the primary healthcare centers or from the primary care providers are referred to the general hospitals. Then we already have an agreement with the general hospitals, so they render the service. After they render the service, they contact us, we give them code, they render the services. After the services, they send it to us, we vet it, and then at the end we approve it and then pay it into their account. So all our payments are through account directly to the health facilities.
This intervention, Basic Healthcare Provision Fund, enhances our services in so many ways. One, it increase the patient flow from the community to the facility, and it helps us in, covering some of our defaulters in other healthcare services. Some people says they don't have money to come to the hospital for services, to buy drugs and other services, but with the event of this Basic Healthcare Provision Fund, they believe that when they come, they can get their drugs free. All that concern them is transportation.
The program of Basic Healthcare Provision Funds and BASHCMA has improved many lives. I can say many lives. More especially vulnerables in Darazo local government.
Gaskiya wannan program din ya taimaka mana sosai saboda akwai marasa lafiya marasa karfi da yawa a gida suna bukatan magani amma kuma ba su da halin da za su zo su sai magani. To da aka samu wannan program na BASHCMA ya taimaka mana sosai saboda patient din sun zo an yi enrollment din su, sunan su waɗanda sunayen su ya fito sun zo suna karban magani ba tare da sun biya ko da naira ba. Kuma idan aka yi musu aiki a nan muka ga ya fi karfin za mu yi referral din su General Hospital Darazo, da su je a ci gaba da musu aiki daga yanda muka tsaya, kuma da a musu kyauta ne ba tare da an karbi ko da neran su ba.
We even have one client in Bauchi LGA that has been referred to specialist hospital Bacchus, and CS has been done to her successfully. And that time the husband was not in a good position to pay for that one.
Gaskiya komai kyauta akan su karɓa kuɗi ba. Har zuwa dai har zuwa lokacin haihuwa aka ma aikin aka mu komai magunguna duka kyauta aka babba mu.
Da idan muka zo muna biyan kuɗi. Amma yanzu kuma da wannan ɗawainiyar da aka mun din iya hidimar da na yi kuɗin mota ne, amma ba na biyan kuɗin magani.
So the challenges of the agencies, as I mentioned, we have 3 programs: the formal, informal, and the vulnerable program. We have comfortably started the vulnerable program, and we are also hoping to start the formal sector program, which include the state and the local government civil servants. We are having some challenges.
The only challenge we have that I can say to the government is we still need additional manpower if possible, because this is one of the major challenges we have. As you can see, most of our staffs here are volunteers, and for you to provide services adequately to your patient, you need manpower. Human resources is number 1 priority.
There's a lot of people who come and say that they want to be enrolled, but we have limited number of people that are being enrolled into the services.